Welcome back to our medical channel, where we dive into the essentials of health and wellness. Today, we're exploring the thyroid gland, what it does, common thyroid disorders, their symptoms, causes, and how they're diagnosed and treated. Whether you're dealing with thyroid issues or just want to learn more, this video is packed with valuable insights. Let's get started. Do you know what role the thyroid gland plays in your body? Nestled at the base of your neck, this small, butterfly-shaped organ is a metabolic powerhouse. It's in charge of controlling the rate at which your body uses energy. From your heart rate to your body temperature, the thyroid gland is a key player in many metabolic processes. It's like the conductor of the orchestra that is your body, ensuring everything works in harmony. However, when the thyroid's function is disrupted, it can lead to significant health challenges. Thyroid disorders can manifest through various symptoms. When the thyroid is overactive, a condition known as hyperthyroidism, you might notice weight loss, a rapid heartbeat, increased appetite, excessive sweating, nervousness, and irritability. Even tremors and more frequent bowel movements could be telltale signs. Some people might also experience an enlarged thyroid gland, known as a goiter, causing a noticeable bulge in the neck. On the other hand, an underactive thyroid or hypothyroidism presents a different set of symptoms. These might include fatigue, weight gain, intolerance to cold, dry skin, and hair loss. Even constipation, depression, and a slowed heart rate could be indicators of hypothyroidism. It's important to remember that these symptoms can vary greatly based on the individual and the type of thyroid disorder. For instance, both hyperthyroidism and hypothyroidism can cause a goiter. Like hyperthyroidism, hypothyroidism can also cause a goiter, which is a noticeable bulge in the neck. Thyroid disorders can result from a variety of factors. The most common culprit is autoimmune diseases, where the body's immune system mistakenly attacks its own cells. In the case of the thyroid, this can lead to conditions such as Graves' disease, which results in an overactive thyroid or hyperthyroidism, and Hashimoto's thyroiditis, causing an underactive thyroid or hypothyroidism. Another key factor is an imbalance of iodine in the diet. As a critical mineral in the production of thyroid hormones, both too much or too little iodine can disrupt the thyroid's function. Then we have thyroid nodules, which are lumps in the thyroid gland. These nodules can lead to increased hormone production, resulting in hyperthyroidism. Lastly, let's not forget about genetics. If there's a family history of thyroid disease, it increases the likelihood of developing a thyroid disorder. It's a fascinating, albeit complex, interplay of factors that can lead to these conditions. Remember, a family history of thyroid disease increases the probability of developing a thyroid disorder. Diagnosing thyroid disorders generally involves a combination of medical history evaluation, physical examination, and laboratory tests. To get a detailed understanding, several key diagnostic tests are employed. The most common one is the thyroid stimulating hormone, or TSH test. This test measures thyroid hormone levels in the blood, and abnormal levels might indicate an overactive or underactive thyroid. Another routine test is the T4 test, named after the thyroid hormone thyroxine. This test is crucial for assessing the levels of thyroxine in your blood. Next, there's the ultrasound of the thyroid, a non-invasive procedure that can help identify the presence of nodules or other abnormalities in the thyroid gland. Lastly, there's the radioactive iodine uptake test. This involves taking a small dose of radioactive iodine orally and measuring how much accumulates in the thyroid gland. This test provides insights into how the gland is functioning. These tests help to identify the type and severity of thyroid disorder. Treatment for thyroid disorders varies based on the type and severity of the disorder. For hyperthyroidism, treatment options can include radioactive iodine therapy, which gradually shrinks the thyroid gland, slowing down hormone production. Medications that reduce hormone production may also be employed. In some instances, surgery to remove part or all of the thyroid gland may be necessary. Hypothyroidism, on the other hand, is commonly handled with hormone replacement therapy, specifically with synthetic thyroxine, also known as levothyroxine. This medication helps to normalize hormone levels, effectively replacing what the thyroid gland would normally produce. In cases where thyroid nodules are cancerous or cause significant obstruction or aesthetic concerns, surgical removal of the thyroid gland may be required. But remember, treatment isn't always medical. Alongside medical intervention, lifestyle adjustments are key. Dietary changes, regular exercise, and stress management practices can all contribute to managing thyroid disorders more effectively. Dietary changes, regular exercise, and stress management can also play supportive roles in managing thyroid disorders. In conclusion, the thyroid gland plays a crucial role in our body. It's a tiny powerhouse regulating our metabolism and energy use. When disrupted, it can lead to thyroid disorders, displaying symptoms like weight changes, mood swings, and more. These disorders can stem from autoimmune diseases, iodine imbalances, and even genetics. But through comprehensive diagnosis methods and varied treatment options, from medication to lifestyle adjustments, we can manage these disorders effectively. Understanding its function, symptoms of disorders, their causes, diagnosis, and treatment options can help in managing these disorders effectively. Stay healthy, and we look forward to seeing you in our next video. Until then, take care of yourself and keep making positive lifestyle choices. See you in next video.